For decades, the script for American urban redevelopment has followed a predictable, destructive path. Cities rely on corporate tax abatements to attract developers, who then drop high-density luxury towers right on top of historically neglected corridors, pricing out the locals. In Columbus, Ohio, the catalyst rebuilding the local skyline wears scrubs and operates under a nonprofit charter. Nationwide Children's Hospital has quietly stepped out of the emergency room to act as a massive master real estate developer. The strategy is driven by a simple medical philosophy. A child's zip code dictates their long-term health far more than their genetic code. Doctors here realize that treating asthma or malnutrition inside a sterile hospital ward is entirely futile if that patient is sent right back to an unstable environment. And for years, the surrounding Near East Side of Columbus suffered from severe infrastructure decay. Abandoned storefronts and commercial deserts acted as a chronic illness on the community. By treating the surrounding streets as an extension of the clinic, the hospital converted residential stabilization into a tool for pediatric health. To treat the area's housing instability, the hospital launched the Healthy Neighborhoods, Healthy Families initiative, explicitly rejecting the standard model of speculative gentrification. This map illustrates their first phase of treatment. Rather than waiting on city grants, the hospital directly entered the capital stack to fund the construction and rehabilitation of affordable workforce housing. Next, they moved to physically eliminate urban blight. They strategically acquired abandoned and tax-delinquent parcels, converting those empty lots into modern infill housing and community green spaces. Residential roofs aren't enough to cure commercial deserts, so the hospital actively recruited neighborhood-scale amenities. They brought in early learning centers and full-service grocery stores to ensure residents had immediate access to basic daily needs. By putting their own money into the local capital stack, the hospital insulated large sections of the district against sudden displacement while setting a reliable baseline for modern urban density. Once that residential baseline was stable, the sheer size of the hospital triggered an economic multiplier effect. Thousands of physicians, data scientists, and administrative staff flood the district daily, creating organic, high-volume demand for local dining and commercial real estate. That deep-pocketed institutional capital established a new innovation corridor. Biotech incubators and health startups are now clustering in adjacent parcels to secure proximity to the hospital's world-class genomic research hubs. This commercial boom accelerated long-overdue public infrastructure overhauls. The district is now wired with modernized digital networks and framed by widened, pedestrian-friendly streetscapes with protected bike lanes. To ensure that the district's high-wage job growth isn't entirely imported, the hospital partnered with Columbus schools and community colleges to build direct, local workforce pipelines. When a massive institution acts as an economic anchor, it creates a self-sustaining ecosystem where biomedical innovation and local community wealth scale up simultaneously. This scale of investment inevitably creates tension. As sleek new construction rises right next to century-old brick homes, the neighborhood navigates a tightrope between necessary revitalization and cultural erasure. This chart highlights the central paradox of surging property valuations. The rising market provides welcome wealth equity to legacy homeowners, but it simultaneously triggers crippling property tax burdens that threaten to push those exact same residents out of their homes. The hospital manages this side effect by deploying targeted home repair grants to legacy homeowners. They also maintain active, transparent dialogue with grassroots community advocates and city planners to closely monitor the effects of their expansion. Ethical neighborhood development requires constant adjustments. The ultimate goal is to ensure that billions in fresh investment actually lift existing residents, instead of merely displacing them to another struggling zip code. The complete transformation of the Near East Side serves as a scalable template for cities all across the post-industrial Midwest. As traditional manufacturing anchors wane across the Rust Belt, massive healthcare and research institutions are often the only remaining entities with the balance sheets and long-term incentives required to execute patient, place-based city building. Look at the visual result of this philosophy in action. It produces a stabilized, resilient, mixed-income urban ecosystem where public amenities and private enterprise coexist. Nationwide Children's suggests that when an anchor institution integrates its neighborhood into its core mission, it can foster a resilient ecosystem where public health and the local economy grow in tandem.